And here we go. Hello, everybody. This is Dr. Jeffrey Hanna here at Clear Chiropractic. And today I've got an interesting little topic that we're going to talk about tinnitus, a ringing sound in the ears, but not actually coming from the ear. I came across a bit of an interesting research article just today here that may illustrate some of the mechanisms about how and why this happens in the first place. And interestingly enough, coming from a spot that even I wasn't fully aware of. Yeah, it links back with a few things, but one of the good things about doing these videos, I often am going to learn just as much, and so want to be able to share that information with everyone pretty much as soon as we get it. So let's jump right into it and have a little look. All right, what we've got here for you is an article, Pulsed Radio Frequency of the Auricular Branch of the Vagal Nerve in Tinnitus Patients. So let me take a wee little step back here for just a sec, because there are two very broad categories of tinnitus. One variety is where you actually have damage to the mechanisms of the inner ear that are responsible for hearing. This is associated with exposure to loud noises, and it produces this persistent ringing in the ear. But there's another category which is known as a somatosensory tinnitus. Imagine, if you would, that there is an internal alarm system going off somewhere in your body. And those messages get transmitted up to your brain, a couple of the wires crisscross, and it manifests as this persistent ringing noise. And it can actually be quite variable to where it's like, yeah, it's just a bit of a mild annoyance. And other times, completely life disruptive, where not only can you not hear conversations, but it doesn't even stop when you are trying to sleep. So imagine, if you would, somebody's continuously poking you in the arm like this while you're trying to sleep. That is going to lead to all kinds of different issues. So even though this is a little bit of a, sometimes people think in terms of the big scheme of it all, oh, okay, it's a relatively mild annoyance. Like, no, this can actually be quite very severe. Now, this little research was done on pulsed radio frequency, so using a type of a magnetic or electrical stimulation to see if it's going to be able to help a certain branch of what's known as your vagus nerve, and if it could actually help people with tinnitus. What did they find and report? 48% of tinnitus sufferers who undertook pulsed radio frequency of the auricular branch of the vagus nerve reported reduced loudness in their tinnitus, which was qualified as being moderate to good in 87% of those patients. In other words, vast majority of people had significant reductions. We're not saying like all the way down necessarily to zero, but substantial improvements in the overall quality of life. Now, I'm going to take a little step back here just so I can explain a couple of things about the vagus nerve that apply then as it relates to tinnitus. All right, here we have a fun picture of the vagus nerve, and it's gone ahead and I have highlighted it in this bright yellow. This is a nerve that comes off of the base of your brainstem and transmits down the very front part of your neck right through here. And it is ultimately going to be the conduit for all of the messages that go to control every single one of your vital life organs. Your heart, your lungs, your digestive system, your reproductive system, everything. It's also the conduit for all of the information going back to your brain about all of these particular systems. But there's a couple other things that I do want to point out. And even though this is a schematic, you don't have to be an expert in neurology right here. If I'm tracing it like this, I will show you first this particular wee little branch located right about here. This is something that's known as the recurrent meningeal branch. This is a branch of the vagus nerve that is supplying the sensory information from the connective tissue around your brain. The brain itself does not have neural receptors that detect pain, but the connective tissue around your brain absolutely does. And what we know is that there is ever irritation, inflammation, involving this particular nerve branch right here. This is what's going to manifest as a migraine. The reason it matters is because, as we know, if a person experiences a migraine, they're going to experience all kinds of other symptoms in their body that can affect their eyes, it can affect their balance, can affect how you feel in the stomach, so a sense of nausea. It's because all of this information travels via the exact same conduit. In other words, there's a connection between these different systems right here. This particular branch of the vagus nerve is also what is responsible for modulating inflammatory responses in your brain. Now, granted, inflammation in your body can come from a variety of different sources. Diet, huge. Stress, huge. Point being is if there is inflammation in your body and these nerves are starting to fire, what that can do is that can affect your brain function. And again, manifest in a number of different ways. Because if you've got inflammation on the brain, it can cause chronic pain, it can cause chronic dysfunction, it can cause dysfunction in any system of your body. How you think, brain fog, memory, the list just keeps going on and on and on and on. So this is the importance of the vagus nerve that I wanted to get down first and foremost. Now, if we go just a little bit farther from this guy, so this would be where it exits the skull, and you'll see that I have this branch drawn right here for you. This is what's known as the auricular branch of the vagus nerve. Auricula is referring to ear. This is a nerve that's responsible for supplying the sensory information of this spot right here between the back of your jaw, the base of your skull, right behind your ear, and where that top vertebra in your neck actually sits. It also has little branches that kind of go into that inner ear area. And this is going to be very, very important then as it relates to tinnitus. Why? Because if you've got messages that are getting corrupted because something is wrong in this particular little spot, this is going to be a case of garbage in, garbage out, a transmission error where normal sensory messages that would be going back up to your brain can get corrupted. And if these messages have anything to do whatsoever and they cross into the parts of the brain that are responsible for hearing, you can have the spillover of abnormal sensory information that sets off that internal alarm that your brain interprets as a ringing kind of noise. This is what the researchers wanted to look at. They wanted to see, was there some kind of an association between this particular nerve right at the base of your head at the level of the C1 and the C2 vertebra, and they did a different kind of treatment than we do in our practice called pulsed radio frequency. As I said before, in brief, it's a slight electrical or a magnetic pulse to see if it can help to modulate the normal nerve signals that are coming for this particular branch. What they would do is they would apply just a little pad just on the outside of the ear, essentially right there. And by applying that, they wanted to see then, was there going to be a reduction in those tinnitus symptoms? And sure enough, that's exactly what they found. All right, so here were their results. So check this out. 2-year period, they had 112 tinnitus patients where they did the pulsed radio frequency of the auricular branch of the vagus nerve. 54 of these patients, so 48%, reported reduced tinnitus loudness at a 7-week, so basically 2-month, post-treatment follow-up. The patients valued the improvements 33% good, 54% moderate, 13% slight. So tinnitus, as we've described and as we've seen in practice over a number of years, is a little bit of a bear. As much as we wish that we could say, oh yeah, snap of the fingers, boom, problem solved, it ain't that easy. There are some people where, honestly, I really expect there are going to be very significant positive improvements in their symptoms, almost nothing at all. Other people where it is, they have all of these other kinds of things and okay, wow, the tinnitus actually goes away. That was an unexpected outcome. But this actually matches what I've found over the years. It's about a coin flip. And even though we would certainly hope for greater probability of success than that, that's better than nothing, especially repeat, because inflammation seems to be a major trigger for people who experience tinnitus, whether it's their diet, their stress, lack of sleep, the list goes on and on and on, that there are a lot of lifestyle elements that feed into this as well. Nevertheless, if there's a treatment that's actually helping about 50% of the people, this is pretty good. This is pretty good. Now, how does this then relate to what's going on in the upper part of the neck? This is what the researchers then did. They went back and they wanted to see, was there a difference between the people who had favorable outcomes and none or unfavorable outcomes, people where things didn't change. They found that they checked age, sex, all of the other lifestyle variables, and they only found that there was one thing that made a difference. And that was the angle that they measured between the C2 and the C3 vertebrae in the neck right here. So I'm going to scroll up just a little bit here first. There we go. There we go. So what they've done is they have illustrated the general shapes of the vertebra in the neck. So square-ish. This would be toward the front. This here toward the back. I've got a silly little model right here where we can kind of illustrate this. I will bring this in so that you can see right here. We're talking about the space between the C2 and the C3 vertebra right here. What they find is that normal circumstances, there's not going to be really too much pressure on a disc. So the disc is the shock absorber between the individual vertebra. But what they did was they made a series of measurements. They wanted to see if there was any difference between if the vertebra was tipping back a little bit like this, or if it was tipping forward. If I'm actually going to turn it around so it's facing the exact same way as this picture. Tipping back would be like this. Tipping forward would then be like this. So let's go ahead, slide this on down, and show that we reported. Of all clinical outcome measures, only the angle between the second and third cervical vertebrae was statistically significant, and I found like 99% of that basically, between responders and non-responders to pulsed radio frequency of the auricular branch of the nerve. Okay, in the tinnitus sufferers with an angle smaller than 3 degrees, on the lateral neck x-ray, 60% had a beneficial effect versus 36% of those that didn't. So let's go back to the little model right here. What do we mean by 3 degrees? By 3 degrees, we're talking about a backward tipping of the vertebra like this. So let's say hypothetically, this is 3 degrees right there. This would be more like 15 or so. They found that the more that C2 vertebra was perching backward relative to the C3, the less likely there would be an improvement in tinnitus symptoms. But the more that would actually start to perch forward like this, they found that those people actually had better outcomes doing the treatment for this auricular branch of the vagus nerve. The question then is, why might that be? Let's have a look here. Remember what we already talked about first. We said that when the vagus nerve exits the skull, it exits and transmits from this little spot at the front of the neck, and it actually goes down along the front of the vertebra in your neck like this. So as the vagal nerve runs in front of the upper cervical vertebra, an angle smaller than average, in other words, if the vertebra starts perching forward a wee little bit, can irritate the vagus nerve and the spinal nerve. Specifically, the nerve can be irritated by the excessive motions of these vertebrae caused by cervical instability or by a kyphotic posture of the second cervical vertebra. What they are talking about here is where there's been an injury to the neck, essentially a whiplash injury. The neck has gone locked forward like this, and it's essentially gotten stuck in this kind of an abnormal flexed forward position. Hence, we can speculate that in patients who benefit from this treatment, the tinnitus may be originated, maintained, or influenced by pathological activity of the spinal, sympathetic, or vagus nerves that run within the C2 and the C3 area. Remember what we said. The vagus nerve is the conduit of all of the information that's going from your neck, from your vital organs up to your brain. In this exact same area, you also have what are known as sympathetic nerves. These are also involved with inflammatory responses, and they control all of the blood flow, all of the lymphatic clearage, all of the basically activity that's going on in every single part of your brain. And if you have the normal nerve that should be running right across this area right here, if that vertebra starts to misalign and gets locked in a forward position, what that essentially is like is having a pebble in your shoe. If it's just a little bit, no biggie. But if it's causing little bits of friction, little bits of irritation over a long period of time, this could very well explain why it is that the messages that are normally going to your brain become corrupted. And as we said, your brain then interprets an internal alarm system that it perceives as a ringing sensation in the ear. In other words, a mechanical cause for what is actually going on. Now, question then is, well, what would be the most appropriate treatment? Well, again, this was not a study that was done on the efficacy of upper cervical chiropractic adjustments to see if by adjusting the C2 relative to the C3 was going to make an impact in terms of the tinnitus. This was more trying to modulate the nerve activity, but it raises a very, very interesting question. If the origin of the tinnitus in the first place may so happen to be that those vertebrae are not moving the way that they're supposed to, and that thing has gotten perched forward, would it possibly then make sense that by making a correction to that area, it can make all of the difference, not just in treating the symptoms, but addressing the underlying cause as well? So as I said, even for me, this is personally very, very interesting because I've always found in clinical practice that the resolution of tinnitus is, relatively speaking, about a coin flip. But this is going to give me a little bit of something extra to pay attention to see if there is indeed some kind of correlation between a forward misalignment of the C2, possibly of the C1, possibly even of the C3 vertebra, being that little pebble in the shoe, and that could be what's related to tinnitus. So that will be very interesting. So watch this space. We'll see what we will come up with here. Nevertheless, one way or another, very interesting, because this goes a long way toward being able to come up with a practical solution for helping people with tinnitus where otherwise they may not find that there's really anything that they can do about it. So I will keep you up to date in terms of what we go. Nevertheless, fascinating information, and there is hope for this. Thank you guys all for watching the video. If you have liked this, please do click that like and subscribe button. Share this video with friends, family, clients, colleagues, anybody who you believe would benefit from watching this. And if you want more information, you can go to my professional website, drjeffreyhanna.com. And if you'd like to schedule a consultation with us to find out what we can do to help, you can reach us through clearchirospokane.com or give us a ring direct at 509-315-8166. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.